You know, this isn't my first trip to Arkansas. Been here a whole lot. There was some other guy I used to be with here. Name slips my mind. A woman, too. It's very good to be here. You know, this whole healthcare debate is so vital to all of our futures, because this is really not an effort to redistribute wealth. This is an effort to redistribute health.
Sure.
And essentially what it is a repeal of the Medicare bill that was passed in 1965. You know, a lot of people come to me and they say, how could you have worked for Bill Clinton and now be so hostile to Barack Obama's health care program? Well, Clinton's program did not include cuts in Medicare. Obama's program is funded by cuts in Medicare. And when I worked for President Clinton, I worked very hard against cutting Medicare. And I don't care whether it's being cut by the right or by the left, Medicare should not be cut. And the reason it shouldn't is that it is so easy to do it, and such a slippery slope to say, well, you're 85 and you have high blood pressure and you're obese and you smoke and all that, and maybe we shouldn't have a heart transplant for you, or a bypass surgery, or artificial limbs, or an knee replacement. It's so easy to say that. And when you think about the core of the pro-life movement, it is to protect human life. And I know there are many that, and there are some who believe that it begins at conception, and there are others who believe it begins at birth, but I don't know anyone who thinks it ends before death. And when Obama says that he's going to cut reimbursements to doctors and reimbursements to hospitals and payments for CAT scans and payments for MRIs, but he's not going to cut aid to patients, who the hell does he think he's kidding? If you pay them less to see patients, they're going to see fewer patients, or they'll spend less time with each patient. And if you cut the number of MRIs and the number of CAT scan reimbursements, you're going to cut the amount of care that the elderly are receiving. So what's the poor doctor going to do? He's standing there, and if he doesn't give the MRI, he gets sued by the trial lawyers. And if he does give the MRI, he gets harassed by the government. Well, the best thing for a doctor to do in that situation is become a lawyer. And really, we are driving the medical industry, the medical profession, out of practice. Do you know how many internists there are in the entire state of Arkansas who accept new Medicare patients? I just learned this earlier today from a doctor. One. The number of graduates of medical school who are going into primary care has been cut in half in the last 12 years. And you have to go through primary care to be able to become a specialist. The others are going to things like anesthesiology and dermatology and other radiology and other fields, but not direct patient care. And that's because of the rapid reduction in reimbursement rates offered by the federal government. And currently, the federal government is planning a 21% cut in the reimbursement rate for doctors. That'll bring it down below the bus fare to get to the clinic in the morning to treat the patients. And then there's something in this bill that absolutely drives me crazy. They set up 7,500 diagnostic categories for health care. And for each category, each doctor has to report to the feds every patient they see and how much they spend on that patient in that diagnostic category. And the top 10%, the 10% of the doctors who spend the most money, whether deserved or not, whether correctly or not, no accounting for their survival rate, no accounting for anything, just the top 10% are required by the statute to be fined each year and have their reimbursement rates cut. So it incentivizes rotten medical care. It says that if you take patients that are really sick and you give them really good care and you give them all of the tests that they need, well, you could be in the top 10% and we're going to... And there's this continued dumbing down of the quality of medical care.
Nobody has ever been able to answer this question. How can you treat 36 million new people without any new doctors and new nurses and new medical equipment?
Now, I believe very strongly that every American should be entitled to health insurance who's here legally. I believe it is a disgrace in this country to have anybody who is not covered. But when you're going to expand the number of patients, for God's sakes, expand the number of doctors too. I mean, duh.